to Medical Dilemma. Before we start our discussion for the second segment, I just would like to mention our major sponsors, Makati Medical Center, St. Clair's Medical Center, and LifeQuest Training and Consultancy Corporation. Now, joining me for the second segment are my co-hosts, Dr. Teresita Sanchez, and Father Jerry Manlangit.
Hi.
Okay. Now, Dr. Sanchez, earlier off the air, you mentioned about the certain qualifications are needed for Dr. Cheung's practice. Maybe we should ask him to clarify some more.
Yeah, it's not an ordinary graduate who can be involved in such a delicate thing, no? And so very innovative and very recent. No? May I ask our guest, how did you come to this specialization?
Okay, so I had foreign training, so as part of my PhD studentship.
But is it right after graduation from medicine, or do you still have to take some other course?
Okay, so in the US, it's now being professionalized. So they are now creating program wherein medical doctors, scientists can undergo a fellowship program to learn how to get involved in this sophisticated technology.
How long would that take?
Normally it takes about 1 year of fellowship.
Okay.
And these are accredited institutions.
Okay. By training, does that mean that you have to involve yourself with different kinds of machines or whatnot?
Yes, that's correct po, Doctora. So there are basic machines wherein you have to deal with or you have to be proficient with. And it takes several months for us to get acquainted with the software as well as with the techniques.
I see.
So it requires sophisticated techniques as
and
well.
you involve yourself with very expensive machines, right?
Yes, that's correct.
Are they insured just in case you damage them in one way or another? It's a machine that should be insured.
Yeah, not the people.
So I'd like to just clarify. So even a non-medical doctor can go into this specialization?
Scientists, I suppose.
Yes, scientists. And this is one good thing about having a facility in our country. Number one, we prevent brain drain. So scientists, brilliant students may opt to stay in our country to learn this technology versus going abroad.
So it's more of a lab procedure, is that correct?
Yeah.
Yes, lab. But who actually injects it to the patient, if ever?
So it's still the medical doctor who has to be the attending physician.
So it's just isolated in the facility, and then it's already safe to bring back to the body of the patient.
Yes,
then
that's
the
correct.
doctor does it. So I'm now clear about it.
Okay. Now, I guess the next logical thing to examine is regulation from the government. Okay, so how are such facilities regulated at the moment?
Okay, so in 2013, I was in a conference and Philippines was lauded because our Department of Health released the Administrative Order 2013-0012. So this is one way of monitoring facilities engaged in stem cell and cell-based therapies. So I think there are many centers, companies offering stem cells indiscriminately.
In the Philippines.
In the Philippines. And that's the reason why Department of Health, together with the FDA, came in to start regulating the use of stem cells.
I see. Are the machines practically the same? Or because I have heard of one, just for parang beautification or to make you look younger, it's just a very small machine. I mean, who should do it? And is that safe?
So these people who have been operating the machine, they must undergo training, and there must be quality assurance. There must be quality control measure.
And
so you cannot simply inject what has been spitted out of the machine to a human being.
Yeah,
so
it's so small. I mean, I think their function is just limited practically to just one aspect. No?
Mhm. And
Of,
that's the reason why we set the bars very high.
Mhm.
So our local authorities are not requiring several tests that we're currently doing. So we set the bar
more than what the DOH is
more than what the
stating.
local governments are asking for. So our standards are really set in the international level.
That would be good.
Well, just to be curious, no, while we are trying to set high quality, setting the bar or standards about this stem cell therapy, do you also in your institution, or is there anyone, any government regulation who give license
That's
to
correct.
to stem cell stem cell therapies? Just like, for example, well, if you are going for a specialization for ophthalmology or cardiology, there is an agency that gives you something like that, kind of a license. Do you
Okay.
have one?
Sir, we have not reached wherein professional society or institution wherein they could provide credits or authority for specific practice of medicine to allow stem cell therapy.
But certainly they require you certain credentials, like training abroad, right?
Yes,
For
yes.
this, do this well.
Foreign training
Safely.
foreign training is really
Local training,
must.
not yet. Or
there
are you starting now?
there are no accredited institutions to provide such trainings po, sir.
But facilities are accredited, is it?
Yes, that's correct po, sir. There are facilities that are accredited by the Department of Health. And the good news is, when you apply for accreditation, they will look into your facility, they will look into your machines, they will look into your personnel, they will look into the training of the personnel. So these are critical elements wherein a cellular product can be assured of in terms of quality and purity.
Does,
You
does regulation also place limitations on what a facility can claim when advertising their services?
Yes, that's correct. So in terms of applications, so DOH is always monitoring the activities of these accredited facilities. So any procedure that will require stem cell therapy, it has to go through these agencies.
But just to be curious, does DOH have also the qualifications to do such inspection, etc. If they do have, for example, expert people, because the only ones who can make inspection and make evaluation or assessment are people who have the know-how.
Okay. Excellent question po, sir. The good thing about our Department of Health, FDA, they have taken on their initiatives to interface with these international organizations. So they have been updating themselves in terms of these developments. So when they perform the auditing, so they have a checklist consistent with these international organizations as well. So things have changed. I'm seeing more dynamic activities in the light of our local agencies.
I see.
Because I've seen some machines and they're so small, and apparently they're only used to get some cells from the individual and then transfuse it again, or if you call that, bring it back to the body. Is that effective? And I think it's limited only to the, certain applications like trying to look younger with a nicer skin or what. Would that be effective also?
Okay.
Of course, it's compared to a big facility that's really doing everything. This is really a small thing, no?
Okay,
It might just be a toy.
what are the cardinal signs if you're dealing with the right facility?
Okay.
Yes.
So if you have a very short turnaround time, that's
Probably.
gonna be something to
It's a red
look
flag.
at. And then
cheaper.
there should be
Definitely.
cheaper.
Cheaper. They can give
And
it for
do
very
they
low.
screen patients?
Mhm.
So that's
Oh.
another thing. Are you being selective, or will you welcome everyone who walks in who has a deep pocket?
Mhm.
So for me, that's a red flag.
Mhm.
If you're, as long as you're willing to pay, you are welcome.
Mhm.
And
You might not
in-
get the whole treatment.
In our
Just part
center,
of it.
that has never been our practice. So we screen patients.
Mhm.
Are you really the best candidate to benefit from this technology? Because at the end of the day, you cannot offer a technology that is, good for everyone. You have to look at it in that perspective.
I presume that with this medicine, or rather this facility that we have here locally, you get the stem cells from where? Is it from the person himself or from other sources? Like I heard if abroad they get it from like the black sheep or
Mhm.
what?
Sheep.
Okay.
Can you elaborate?
So the Department of Health is very clear on this. So what is allowed is autologous, meaning from your own. So you cannot get your stem cell from another animal.
Or from a Carabao, that's what is available here. But
So-
we have heard of some personalities who have gone abroad and
And
they do that, or even some clandestine locations where they get the source even from abroad,
mhm.
from animals. Have you heard
That's-
of this?
That's the danger of this technology if it's being used
And abused.
and abused for another reason.
Uh-huh.
So number one, a very good analogy would be kidney transplantation between siblings.
Mhm.
This is from human to human. Oftentimes, it's being rejected. How much
Yes.
more if you're going to source it from
An animal.
an animal?
An animal.
Yeah.
So
Yeah, but
That's-
of course we have heard success stories, but I think
Only heard. Might be
We've never
anecdotal.
seen them.
yeah,
Only
nobody wants to
anecdotal
admit or
for
to
that matter,
deny.
or probably they're trying to hype it so that more and more people would, avail of it,
mhm.
even if, it doesn't really promise that much.
Yeah, but I've heard that if the source comes from an animal, there is like a 30% chance of a tumor developing in that the recipient. Is that correct? Is
That's
it
correct,
possible?
Doctora. That's the danger of using stem cell therapy, in unregulated fashion.
Yes.
Because number one, once it's inside your body, there's no way of taking it out. And we always educate our patients. So it's something that cannot be removed right away. It's unlike medicines, drugs. Over time, our body will be able to clear it away.
Excrete it or
Yes.
what?
But not
But-
cells.
Dissipate it or
But
what?
not cells. Once they engrafted, it's all yours.
I see.
My feeling about stem cells is that they're very intelligent. No, they go where you need them. So, for example, if your eyes need them, you inject it directly to the eye. What about if you need it for the liver or the pancreas
Okay.
or for the heart? Do you inject it very near there, or how is the procedure actually?
For cardiac procedure, we inject it directly into the
Into
heart.
the heart.
So we are teaming with intervention cardiologists.
So they mimic these cells actually
And
near.
they have this thing called homing capacity. As I mentioned a while ago, it's like a healing within our body. There's a trouble or injury. These cells will go in the direction wherein they have to play a significant role. So the
So you
nature
inject them. You inject
so
them.
it can be injected IV, and then
For
for some reason they have the capacity to migrate, to go where the action
is.
is. So
Okay,
there's a
Doctor,
signal.
we'll have to hold that last point for a few moments. Okay, it's time for another commercial break. Don't leave this channel. We'll be right back after a few words from our sponsors.
careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other settings, right? So you hear it, you see it, and then you can smell the fireworks.
Now, would it be okay by asking you're already practicing
You leave a word to your audience.
Something that I've learned is
Words can inspire and words can destroy. Choose yours. Okay? Thank you so much.